Hi everyone, my name is Jolene Kindhart, and this is my implementation narrative for my syllabus design project. The syllabus that I created was designed for health science students preparing for patient care technician and EMT pathways. These learners are hands-on learners, practical, and often balancing school, work, and family responsibilities. Many of them are adult learners or even young adults who benefit from structure and real-world relevance. The learning objectives in my course really focused on helping the students build those core patient care skills to help apply safety and infection control procedures, which we all know is very important, and developing communication skills and strengthening their clinical reasoning. To support these goals, I built a series of activities that were really grounded in adult learning theory. Some of the main activities that I did included hands-on practice sessions, skills demonstrations, small group scenarios, reflection prompts, and then quick knowledge checks, and then finally the final skill performance assessments. Each of the activities that I created was designed to be realistic, to be relevant, and really closely connected to what the students will actually face in the healthcare setting. Why did I do it this way? My rationale really came directly from the concepts that we studied in the class. So from andragogy, I focused on the relevance, experience, and the autonomy. From Kolb, I followed the cycle of concrete experience with reflection, conceptualization, and active experimentation. And then from cognitive apprenticeship, I really used modeling, coaching, scaffolding, and then fading to really help the learners build the skill and the confidence that they need. Everything that I included was intentional and aligned to theory. So some of the tools, artifacts, and strategies that I used included skills check sheets. So they had those ahead of time. They could look through those before, in practice before they were ready to check off with me. We had PPE and patient care equipment, scenario cards with symptoms and vital signs, reflection sheets, visual aids, anything from the actual equipment to maybe videos to charts or diagrams, and then guided practice structures, and then realistic patient care routines. The artifacts that I used really work together to help support the learners through each phase of their learning process. In my presentation, you will see a couple slides that show some pictures of doing some skills. So the first one, that first activity, I demonstrated proper PPE, donning and doffing. So personal protective equipment putting on is donning and taking off is doffing. And I used the checklist that we have for that particular skill. So every skill I have has a checklist. And then the learners then practiced step by step while I coached them. I showed them first, they practiced step by step while I coached them, and then they were able to kind of go off and practice on their own until they were ready for that final assessment. For the second activity, I used a scenario card describing a patient with dizziness and abnormal vital signs, and this really helped the learners practice that clinical reasoning in a low-risk, realistic way. They had to assess the patient and then take the vital signs and notice that there were abnormal vital signs. For the third example, I used backboarding. So I used a backboarding skills check sheet to guide the students through a full spinal immobilization scenario. So we do this when a patient has that potential for spinal injury. They practiced scene approach, they practiced manual stabilization, log rolling technique. I actually have a picture of me showing them that log roll. They practiced securing the patient with the straps, and then team communication, which is so important in everything that we do. The checklist helped them go from kind of clumsy, where do they put their hands, kind of that uncertainty, to coordinated movement that was real practice. The photos then represent how the syllabus really moved from paper to that practice aspect. Implementing some things that I learned, implementing my syllabus really taught me a lot of different things. It taught me that adult learners really appreciate structure, but also want room to make decisions. Modeling skills is really important before expecting the learners to perform them. They have to be able, not just for somebody to tell them how to do it, but to show them how to do it. Real world scenarios really motivate learners more than worksheets. So that hands-on, that real world is definitely a motivator for the students. And then guided practice really helps build their confidence. The more they do it, the better they feel, the more confident they are. And then reflection really helps the learners understand not just what they did, but why it really matters. And this process really helped me see how powerful intentional instruction design can really be. So thank you for viewing my syllabus implementation. This assignment really has helped me grow as a CTE instructor, I really truly believe. And it's really strengthened my ability to design meaningful learning experiences for health science students. Thank you again.